Previously, we were discussing acid-base balance and the role of the respiratory system and the urinary system. We learned that the reason that we breathe and take in oxygen is to fuel cellular respiration, where we break down our food, glucose, through the glycolysis, citric acid cycle, and then in the mitochondria of our cells, we go through what's called cellular respiration. The goal of that is to make ATP, our cellular currency of energy, to fuel all of our metabolic work, so everything that we have to do inside of our bodies and cells. Our waste products are carbon dioxide, water, which we learned was the water metabolism. Whenever we are transferring energy, there's always going to be some heat created, so energy that's lost as heat. And we learned that all of our metabolic reactions make acid. Carbon dioxide and water together make carbonic acid. This happens without an enzyme, but inside of our bodies it happens more quickly because we have the enzyme carbonic anhydrase. The respiratory system's job is, yes, to supply the oxygen necessary to go through cellular respiration so we can make ATP, that's why you have to breathe, but also to rid our body of our waste gas, carbon dioxide. Our waste gas, carbon dioxide, in the presence of water, forms carbonic acid, which is a weak acid. When acids dissociate, they donate a hydrogen ion. As far as the respiratory system goes, the respiratory system can increase rate and depth of breathing, or it can decrease rate and depth of breathing. When we increase our rate and depth of breathing, we're increasing the amount of carbon dioxide that leaves the body, and wherever carbon dioxide goes, acid goes with it. When we exhale, that hydrogen ion is going to leave as water. And you know this when you breathe out. You know that there's condensation. You can use it to clean your glasses or your phone screen. If we breathe less, so when we hold our breath, our body's constantly generating carbon dioxide, which in the presence of water will become carbonic acid. So when we breathe less, we're holding on to acid and our pH goes down. So we can breathe more and get rid of acid, so pH goes up, so hyperventilation. Or we can breathe less, hold on to carbon dioxide, carbonic acid, and our pH will go down. The kidneys are by far more powerful in their ability to help us maintain a stable pH. If our pH drops, the kidneys will reabsorb that bicarbonate ion into the blood, and bicarbonate is a base. It can accept a hydrogen ion and then excrete those hydrogen ions in the urine. Most of the time we're making acid, so this is what's happening most of the time, and pH is usually acidic, so average pH 6. If the pH goes up, that's okay. The kidneys can then hold on to hydrogen ions, lowering the pH of the blood, and then excreting bicarbonate, or getting rid of bicarbonate in the urine. The problem with the kidneys take time to make urine, so they're going to be slower in their response to acid-base imbalances compared to the respiratory system. Whereas respiratory acidosis and alkalosis are kind of easier to understand, we learned that respiratory acidosis, anytime somebody has respiratory disease, there's going to be a buildup of CO2 and a drop in pH. We talked about respiratory if we overbreathe, so when someone is hyperventilating, they're blowing off more acid than is being made. Metabolic acidosis is a little more confusing. It is due to the accumulation of acids any other way. So anything that doesn't have to do with respiratory function and the pH drops is going to be metabolic acidosis. Number one way is if the kidneys are failing to excrete those hydrogen ions and failing to conserve bicarbonate, because it's the kidneys, they're the most powerful in regulating our acid-base balance. It could be that somebody is making too many acids. If they have untreated diabetes mellitus, diabetic ketoacidosis, they're breaking down a lot of fats, making a lot of metabolic acids, then that would lead to metabolic acidosis. Another way to get to acidosis is if we lose our bases. There's one place in the body, it's the proximal part of the small intestine. We've got the pancreas making bicarbonate-rich juice. So if somebody has prolonged diarrhea and loses those alkaline secretions, or prolonged vomiting and loses those alkaline secretions, that could lead to metabolic acidosis. Metabolic alkalosis, you won't see that a whole lot, but if somebody has their stomach emptied, either through gastric lavage, so being drained, having their stomach pumped, or through vomiting, they can lose their acids. The stomach is pH 2, and that could throw their pH off and raise the pH. So we get alkaline substances and get to metabolic alkalosis. It could be that they're ingesting drugs, particularly antacids. So if you have an acidic stomach or heartburn, you take Tums. If somebody is over ingesting those, that could also lead to metabolic alkalosis. When a patient is being assessed for pH imbalances, there's something called ABGs. It's a test that's run that stands for arterial blood gases. Blood is taken. The gases that are being measured are oxygen and carbon dioxide, so partial pressure of both, and the pH is also measured. What we can determine from ABGs, we can tell if somebody's in acidosis, alkalosis. We can also tell if it's respiratory or metabolic, and we can tell if the other system is compensating. The respiratory system and urinary system are going to work together to maintain acid-base balance. So we're going to go through some patient scenarios, and we are going to learn how to tell first if it's acidosis or alkalosis, and we do that by looking at pH. Then we're going to determine if this is due to a respiratory issue or a metabolic issue. So we're going to look and see which value is off. Partial pressure of carbon dioxide, this is a respiratory gas, and we've learned the rule Rome, so respiratory is opposite. So if pH is going one way and the partial pressure of carbon dioxide is going the other way, we know it's a respiratory problem. For metabolic issues, we look for the values of bicarbonate, and we learned metabolic is equal. So if pH is going one way and bicarbonate is going the same way, then we know it's a metabolic problem. The next question we want to answer is the other system that doesn't have the problem trying to help with the acid-base balance. Is it compensated? And sometimes it's not compensated at all by the other system. Sometimes it's compensated a little bit, so partially, and other times you're going to have patients where they have a respiratory and metabolic issue, but they are still in pH balance, and that is because that other system is fully compensating it. So we're going to go through these together. Normal range for pH, you do need to know this for your exam, is 7.35 to 7.45 with a target of 7.4. If a patient's pH in ABGs is below 7.35, they are in acidosis. If it is above 7.45, then they're in alkalosis. Normal values for partial pressure of carbon dioxide are between 45 and 35 millimeters of mercury. For bicarbonate, normal ranges are 22 to 26 milliequivalents per liter. And no, you do not need to memorize these. I'll give it to you if I want you to know that. So I've given you this table. Either it's on your worksheet or you can find it on D2L. And like I said, homeostasis is 7.35 to 7.45. At this time, we're going to say then breathing rate is going to be balanced with metabolic needs. The partial pressure is going to be just right within range, and the amount of bicarbonate in those arterial blood is also going to be within normal range. If we go below 7.35, that's acidosis. How we could get there through respiratory would be hypoventilating, so that means a decreased rate and depth or decreased gas exchange, so decreased external respiration. It would mean that that carbon dioxide is not leaving the body, so we're going to see PCO2 goes up, and this is where the thumb thing or the direction. Notice pH is going down, but PCO2 is going up, so that tells you it's a respiratory issue. If this was due to metabolic reasons, so metabolic acidosis, you see our arrows, pH has gone down, and that bicarbonate would be low as well. Over here, if a patient's pH is above 7.45, that's alkalosis, so arrows going up. How someone could get there, they could be over-breathing, so increased rate and depth beyond what their activity level warrants. So our pH has gone up. If someone is over-breathing, they are blowing off. There's carbon dioxide, so too much is leaving, so that would be low. So this is up, this is down, that's where we get respiratory is opposite. If it is a metabolic issue, then bicarbonate would be very high. Bicarbonate is a base, so pH would be high and bicarbonate would be high. Here is our first patient. These are the normal values and this is the patient. So we can see that the pH is 7.29. We know that that is below our normal value. So that tells you if it's acidosis or alkalosis. So that would be going down. Then we have our partial pressure of carbon dioxide. It is above normal range, so that's high, that's going up. And then we see our bicarbonate is within normal values, so there's no direction to that. So this patient has correct respiratory acidosis. pH has gone down, partial pressure of CO2 is high, that satisfies our respiratory is opposite rule. Good job. Next patient, pH is 7.61, so that's high. Partial pressure of CO2 is in normal limits, and we have our bicarbonate is 37, so that's high. Good job. We know that it's high, so 7.61. We know that we are in alkalosis. This partial pressure of CO2 is in normal range, but we can see that bicarbonate is high. So both pH is high and bicarbonate is high. Metabolic is equal, so this is metabolic alkalosis. This next patient, pH 7.54, so that is above our normal values. Partial pressure of CO2 is 24, so that is low. Bicarbonate is 23, which is right here in the normal range. So what is your diagnosis? pH is high, so it is alkalosis. We've got our partial pressure of carbon dioxide is low. So pH is high, partial pressure of CO2 is low, so that satisfies our respiratory is opposite, so that satisfies our rule. So we know that we have respiratory alkalosis. This could occur, somebody is hyperventilating, so they're blowing off more CO2 than their body is creating. The bicarbonate is 23, so that's in normal values. This next patient, 7.32, you see our pH is low, our partial pressure of CO2 is 44, and our bicarbonate is 21. So what is your diagnosis? Great. So pH is low, so that's acidosis. PCO2 is in normal range, and bicarbonate is low. So pH is low, bicarb's low, it's metabolic acidosis. So next, let's talk about compensation. We said if one system has a problem, the other system can compensate. So if respiratory has an issue, renal can compensate. And if the kidneys have an issue, then respiratory can compensate. So a way to see if there's compensation, a way to ask that is, are both partial pressure of carbon dioxide and the concentration of bicarbonate out of range? So that's what I mean by off. So look at your results and tell me, is there compensation? Okay, mixed crowd. So we know that pH is low, so we're in acidosis. We can see that partial pressure of CO2 is within normal range, and we see that bicarbonate is low. So we said this was metabolic acidosis. And because they are out of pH balance, and this is within range, there is no compensation in this example. So let's look at compensation. So let's look at this patient. 7.36 is their pH, 30 is their partial pressure of CO2, and 15 is their concentration of bicarbonate. So make the appropriate diagnosis. Right, 7.36 is within normal range. Now it is on the low side, but it's in normal range. All right, so what type of issue is this patient experiencing? So we're going to do the same thing we did in the other examples. We're going to start off with our thumb down. So 7.36, like I said, it's in normal range, but it's on the low side. So pH is low, and partial pressure of carbon dioxide is low, and bicarbonate is also low. So all three of these are low. So apply your Rome rule and answer, is this a respiratory issue or a metabolic issue? That's right, this is a metabolic issue. So if we follow our Rome rule, pH is on the lower side and bicarbonate is low, so they're the same direction. PCO2 is also low, so it isn't a respiratory issue, because if it were, then this would be high. So what's happening in this case, this would be an example of your renal patients. So it is a metabolic issue. Let's say they have kidney disease. So the kidneys are unable to hold on to bicarbonate and get rid of acid. So the respiratory system is trying to compensate, and the way the respiratory system can compensate for acid is to overbreathe, so hyperventilate, get rid of more CO2 than is being made. So that's why you see that this value is low, because in an effort to compensate for the kidney's malfunction, the respiratory system is blowing off acid. And so in your kidney patients, they are going to be breathing at a higher rate and depth than their activity warrants. So if you call them in from the waiting room to come to the back, you may hear that they're out of breath. So respiratory can compensate for urinary. And this patient is completely compensated because they're within normal pH values. Good job. All right, let's look at another patient. So 7.36, 75 is the millimeters of mercury, is partial pressure of carbon dioxide, and 40 milliequivalents per liter is the amount of bicarbonate. So answer this question. Right, this person's in normal pH. They're neither in acidosis or alkalosis. All right, so now we know we've got some values off. So what type of issue is this patient experiencing? And so apply your Rome rule. This is in balance, but it's on the lower side, so start with pH going down. Since pH is on the lower side, and we see that partial pressure of carbon dioxide is very high, these two values are off in the opposite direction. So this is a respiratory issue. Go ahead and we'll look at this next value. So pH is a little low and bicarbonate is high, and normally if it was a metabolic issue, the direction would be the same. So what we have here, now we have the opposite to our other example. This is a respiratory patient. So COPD, bronchitis, pulmonary fibrosis, whatever it may be, they're unable to blow off or exchange and get rid of carbon dioxide. So that is building up in the blood. So that's being driven high. Carbon dioxide, carbonic acid, pH goes low. If this is a slow to develop, so a chronic disease, which often bronchitis, emphysema, COPD are, the kidneys have time to adjust. So what the kidneys are doing in an effort to compensate for these respiratory issues, the kidneys are holding on to the base bicarbonate. Okay, so let's look at some examples where the patient, there's compensation, but they're only being partially compensated. So this patient, 7.27 is their pH. Partial pressure is 49, so that's a high. It's outside of the range. And bicarbonate is also high. So go ahead and determine which type of imbalance they have. We've got a low pH, so it's definitely acidosis, so good job. So pH is down, up. So respiratory is opposite. So this is respiratory acidosis. pH is low and bicarbonate is high. That does not satisfy our metabolic is equal rule. So the next question is there compensation? And the way to ask, are both the partial pressure of CO2 and bicarbonate off? Meaning out of range. Correct. So in this case, we said pH is low, partial pressure of CO2 is high. In this case, they have a respiratory issue. The kidneys are holding on to bicarbonate, but it's not enough to keep them in pH balance. So that's just what's meant by partial compensation. Both these values are off, but we're still out of normal range. And let's look at our last patient. So 7.32, so that's low. We've got low PCO2, so partial pressure of carbon dioxide, and we have low bicarbonate. So what is your diagnosis? The pH is low, so it is definitely acidosis. And if you're having trouble remembering acidosis from alkalosis, acidosis has a D in it, so pH is down, and alkalosis has a K, so the pH is kicked up. So this is metabolic acidosis. We know this because pH is low and bicarb is low and metabolic is equal. So the next question is there compensation? And you answer that by are both partial pressure of CO2 and bicarbonate off? Yes, carbonate is low, so metabolic is equal. This is also low, so it is a metabolic issue that respiratory is trying to compensate for. Partial pressure of CO2 is low because the person is hyperventilating. Carbon dioxide is leaving the body in an effort to rid the body of carbonic acid and try to at least help maintain a stable pH. So it's just an example of partially compensated. This is harder than any question I'm going to ask you on the exam. Do know pH. I will give you the normal values for partial pressure of carbon dioxide and for bicarbonate. Should be able to know if I give you values or say one is high and one is low, identify if it's a respiratory issue or metabolic issue, and then how to tell if there's compensation, and then what would the kidneys do to compensate respiratory, and what can respiratory do to compensate urinary? Have a great day.